Good morning, good afternoon, good evening. This is chapter 12, part 2, and I hope you're all well. So moving on, we're talking about obesity can impact the energy balance and cancer risk. There's a multitude of things that can happen. So insulin and insulin-like growth factors can affect the ability for insulin to function properly. Sex hormones, when you have high levels of fat tissue, you're going to have an imbalance in your sex hormones, especially an overproduction of estrogen, which can lead to issues. You can also release substances from those fat cells, which are just like cytokines we spoke about previously. And some of these adipokines are positive, some of them are negative. With obesity, and when you are too heavy, you're going to have an imbalance with the bad ones, kind of superseding the good ones. So the mechanisms are not really clear. Those three above do have very impactful effects on the body. Alcohol consumption is really toxic. So the risk for cancers are increased, and you see all those areas that you ingest it. Also, the liver. The liver is very, very sensitive to alcohol and high levels of, because that's where it's processed. The liver will break it down. And it can not only stress the liver, it can eventually cause a fatty liver if there's excessive alcohol intake, which can lead to cirrhosis and scarring. So it also tends to affect the colorectal area and the breasts at high levels. So they say that there is no safe limit. However, if you're going to drink in moderation, I think that is, known to be okay. And the limit they have said for years for women is 1 to 2, and for men is 2 to 3 a day. I don't know. That personally, and once again, this is not a medical opinion, that seems high. And once again, I think it stresses the body on a regular basis. So, and then genetic factors can be evolved as to your predisposition to alcohol consumption, of course, and higher levels can cause more problems. Physical activity, if you could put physical activity into a pill and market it, it would be worth $1 billion. It does so many good things for your body, mentally, physically. And in this case, they're talking about reducing the risk specifically of these cancers, independent of weight changes, because it makes your body function better. You use up extra glucose, extra sugars. Your insulin will work better. Increases scavengers that eat up the free radicals, which you get from, improper diet and daily living. Increases gut motility. It can make your inflammatory mediators function better and improve your immune function. It does a multitude of things. It's just great. I know for me, exercise is key for my mental health. Air pollution is pretty straightforward. I think you guys can figure that out. And depending on what you inhale can cause more damaging issues. Of course, a little bit of dust is not going to be as dangerous as inhaling asbestos, for example. So you do want to be careful if you work around things that are carcinogenic, to use the proper equipment to keep yourself safe. And then you could see, I was just reading through that last one, research focused on fine or ultrafine particles that are easily absorbed by the lungs and phagocytosed. Your lung, when functioning properly, can't eat them up. It depends on how much you're bringing in, how much you can fight off, and what those substances are, as we spoke about in the previous paragraph. Here's the size of dust and pollen, and you could see how easily it can sneak into your body because it's even tinier than a strand of hair. Indoor air pollution is also pretty straightforward, with tobacco smoke being right up there. And then radon gas. So radon can come from your basement, and that's why you always should have a radon detector And not only is that an issue for cancer, you can also have higher levels of carbon monoxide. Carbon monoxide is very dangerous to us if we inhale it. I don't know if any of you have seen someone with that. They tend to look very healthy. So it's a bit of a tricky thing because that carbon monoxide gives you a very pink cheeked appearance. But what it is doing is very detrimental. It will actually take up the sites where oxygen normally attaches in red blood cells, and it won't let oxygen attach. And it takes up those spots. We're not getting the proper amounts of oxygen. Our tissues don't get oxygenated, and it can be deadly if it continues. Okay, and exposure from heating and cooking sources can increase lung cancer as well. Now, take a minute, read through this, see which one is true. Once again, you want to read every single word of both the question, get the idea in your head, and then read through the answers and see. In this case, it will give you a little tip. Don't read quickly because does this link with this? Okay. You can pause the tape. I'm going to move on. D, once again, that miracle in a pill. If we could, put physical activity in a pill, we'd be really good to go. So what it does go on to say is which is linked with what. So chronic alcoholism, once again, you can see what that's linked with. HPV, genital warts, in case you're not aware of that, you should review that, is linked to cervical cancer. UVR, so that's UV rays, causes basal cell carcinoma and squamous cell carcinoma. And also melanoma. I'm shocked that that's not in there. Going a road trip in here, kids. We're going to go. You're not kids. I'm just joking. I'm going to show you cell cancers, skin cancers. Okay. So great picture. And the reason I like pointing this out to you guys is because you will be on the front line of this. You may see these cancers. I know that I've caught two when I was a chiropractor, and I was only a chiropractor for 10 years. So bringing up this picture here, melanoma is from freckles and dark spots on the skin. And of course, you want to make sure that there aren't any changes in the perimeter, there aren't any changes in the depth, and there aren't any changes in the colors. Basal cell is going to come from the basal layer of the skin, and it has a much different appearance. Sometimes it can have a shiny appearance as well. Squamous cells are from the stratified squamous cells of the body. Oh, this is an even better picture. Let me bring this up. I had melanoma, so this is something that I like to go over with people because you may find this. So this is detecting the melanoma, and I wanted to go through this A, B, C, D's, and E's. Asymmetry, border changes, color changes, diameter changes, and evolving. Since I've had melanoma, they actually, at the dermatologist, take pictures of my skin because this little bit of change can be an issue for me. So A, B, C, D's, and E's. And then back to this picture. I was trying to find one that had a different type of basal cell. But there's basal cell. It has a little bit more of, it can appear a little more shiny. Okay, and you can see this picture here. Squamous cell, my grandmother, God rest her soul, had squamous cell, and she thought that it was a scab that kept scabbing over. She kept picking at it. So if you have something that continually shows up on the skin, it could be a squamous cell. And then melanoma is a change in moles. Merkel cell, very, very rare and aggressive. You're probably going to see these. Has real shiny round appearance, and Merkel cells are cells that are actually receptor nerve cells in the skin. close those down. I have some other pictures up for you guys when we get to them. All right, so ionizing radiation, you can get this from x-rays, you can get this from flying, you'd be exposed to it, you know, in specific situations. There's a graph in the next slide. Can increase multitude of cancers. It has a bimodal distribution, which means really young, really old have the highest risks of having issues from it. And you can damage sperm cells and oocytes, or females' egg cells, with ionizing radiation. That is why we cover the genitals when we do x-rays on people, so that way we can protect those germ cells, which are the precursors to the cells that would form a child. Medical exposure is increasing significantly. I am not sure what your book is getting at with that, because from what I understand, x-rays are faster, they're less exposure to radiation, CAT scans are better. So somebody give me an answer, first come, first serve, I'll give you an extra credit point. I'm also going to bring the book home so I could take a look too. Ionizing radiation, there's a breakdown of where the most exposure is. So if you want to take a look at that, you can, just pointing out, get those detectors, okay, because that's the biggest source of exposure. And not that every house has it, of course, by any means, but some do. So ionizing radiation can also affect the surrounding cells. So it may not be a cell that's been touched by radiation, but a surrounding cell can. And once again, what will happen with radiation is radiation can affect the cells that is directly hitting. It can also release electrons and abnormal ions that can affect surrounding cells. So I tried to sort of pull up a picture for you. So you can see here the indirect route. And this is showing radiation hitting water, which shoots off a free radical, which can be an electron in general, which then can come in and damage the DNA. There's also the direct route where radiation just comes right in and damages the DNA. So I think it is important to know the difference between those two. And this shows the electron coming in, but I think this other picture really gives you kind of one and done picture of an indirect versus direct route. So once again, the ionizing radiation comes in. From what I understand, it kind of almost shakes the DNA strand, and it can damage the DNA strand directly. Indirect route, we can shoot a free radical or a charged particle into it, which can separate these nitrogenous bases and cause them to not be connected, to not work effectively, can't reproduce that DNA, and also can't form proteins like it used to, because that DNA is damaged. Acute exposure especially affects organs with highly proliferative cells. So we know that different tissues have different mitotic abilities, it's called. Your liver is highly mitotic. Supposedly, over 7 years, your liver regenerates itself. So those, because they rely on DNA to create more cells, more new cells and fresh cells and replicated cells, those will have more opportunities for the DNA to be damaged. Excuse me. So also that non-targeted radiation effects, so not the direct damage from the radiation, but the surrounding damage from the cells and tissues that are affected, can not only release electrons to damage other cells and DNA, it can also alter that tissue signaling, which is so important for cells to signal to each other that they are replicating, they're healthy, they have immune changes, they need inflammation, etc., causing microenvironment changes. Radiation-induced cancer has latent periods, so it may not be immediate, could be a later period of time. Okay, and those risk estimates for low-dose ionizing radiation are debated. So depending on whatever research you might be reading at the time. UV radiation, principal source is obviously sunlight, and it is essential for vitamin D formation, and that vitamin D formation will then help the absorption of calcium from the intestines. Now, at high levels, we are at increased risk for skin cancer. There's melanoma. That's okay, but I'm glad that's in there. We already showed you a picture of that. That's the most lethal. That's the most prone to get into the bloodstream or the lymphatics and spread to another location. Basal cell is lower epidermis. Basal means towards the bottom. And those cells from basal cell carcinoma come from that lower level, but then can show up on the top layer of the skin. Squamous cells are the cells on the top layer of the skin. They are the sun-exposed areas. They all can be exposed to sun, realize, that can cause these cancerous changes. And that squamous cell can present as the, like I said, my grandmother used to pick at her squamous cell, flaky like skin that keeps regenerating itself. So electromagnetic radiation, if you're into alternative medicine, there's all sorts of theories about switching over to 5G and if this is an issue. And we have, electromagnetic radiation everywhere. I don't know. I guess in modern day, we're exposed to a lot more things. So this may or may not be carcinogenic. Who knows? Who knows what the research will show? I know that I would not move near a whole bunch of power lines, I can tell you that much, just to be safe. But none of that is scientific. These are just theories. So these are different substances that can cause cancers. Some of these are viral, some of these are bacterial. H. pylori or Helicobacter pylori is a bacteria that can cause 75% of all stomach cancers. It's a nasty little bacteria that's corkscrew shaped. It likes to literally screw itself into your stomach, and it can cause kind of that chronic reflux that patients have. You test it with a breath or a blood test, and then you go through a series of antibiotics which can kill it off. If it's not found, it can eventually cause stomach cancer. Hepatitis B and C can lead to liver cancer. Epstein-Barr virus can lead to nasopharyngeal carcinoma, lymphomas, gastric. HPV, which once again is genital warts, can lead to cervical cancer. So that is why there was a big push for the vaccines to try to prevent it as much as possible. There's many different strains of it. So people may have HPV that is a milder strain that doesn't promote cancer. There it is. I got ahead of myself. Okay, most common STD causes cancer of the cervix. It can also be different, any areas that the HPV has infected. And of course, with intercourse, many of those areas can be affected by HPV as well. Pap test is the best one we can have for screening, and also being aware of normal versus abnormal and having patients be aware of that and watch for any changes in any of these regions for themselves. Okay, chemical and occupational hazards can lead to a multitude of things, and I think it sort of ties into previous conversation we've had. And this is, interestingly enough, something that my 13-year-old has been looking into chemicals that are in water and plastic bottles and toys and personal care products and whatnot. We are exposed to many chemicals, and these chemicals can be personal products, they can be occupational. It's the way of the world, unfortunately. These can cause upper respiratory issues, lung issues, bladder issues, peritoneal issues. Peritoneal cavity is where the abdomen is all the abdominal organs are. Asbestos is a big one. I'm sure you've seen the commercials on mesothelioma, and lung cancer is a byproduct of asbestos exposure. And A lot of these things are things that people are not aware of. Dyes, red number, whatever it was that we used to have in M&Ms and explosives. Interesting that they include that. It's everywhere. But what can we do as part of modern life? And as my friend who studies cancer says, the biggest complication with cancer is stressing about things. So I guess do your best to limit these exposures and don't be too stressed about it. Question number 2. Change in lifestyle factors in controlling bacterial infection from H. pylori is responsible for a decrease in which type of cancer? So you can pause it if you need a minute. Stomach cancer. For me, I know I'm trying to give you ways to memorize this information. So once again, I told you H. pylori. Let's see if I can. It's giving you sort of a little spiral shape here. But what I always thought, because I learned it was spiral shaped and we just saw that on the NIH. So this bacteria has a spiral shape. So it corkscrews into the stomach. As I would memorize things when I was going through my doctoral program, I would literally picture that in my head corkscrewing into the stomach. So I'd picture the stomach and I'd imagine it corkscrewing in, and that would be enough for me to memorize it. The more you can make those correlations and ways to memorize things quickly, the better off you're going to be going through this really difficult program. So stomach cancer has dropped, probably because we've recognized H. pylori a little more recently. We test people a little more recently for it. Lung cancer has decreased with smoking, but I would be interested to know about vaping. I know that's been an issue. Radiation-induced cancers include some leukemias. Low intake of folic acid is correlated with the increased risk of colorectal cancer. And so remember to read through these answers as well as the slides themselves. That is it for this chapter. Let me know if any of you have any questions. I'm happy to help, and I hope you all have a great week. Take care.